Hello everyone and welcome back to our channel. Today, we're diving into a topic that every clinician encounters: white lesions of the oral mucosa. Now, seeing a white patch can sometimes be a red flag, making us think about premalignant or even malignant conditions. But the truth is, many of these lesions are completely benign and require no treatment at all. In this video, we're going to focus on 3 of the most common harmless white lesions that you should be able to recognize with confidence. These are Linea, alba, leukoedema, and frictional keratosis. For each one, we'll break down its location, appearance, cause, and most importantly, its management. First up is Linea alba. This is a benign reactive condition of the oral mucosa that you've likely seen countless times. The most important thing to remember is that it requires absolutely no treatment. So, where do you find it? Linea alba appears on the buccal mucosa, which is the inside of your cheek. Specifically, it's located exactly at the level of the occlusal plane, that the line where your upper and lower teeth meet. This specific location is a dead giveaway for diagnosis. You can see it in patients of any age, from young children to older adults. What does it look like? It's usually bilateral, meaning you'll find it on both cheeks. It presents as a thin, white linear marking that perfectly follows that occlusal plane. Patients are almost always completely unaware of it because it's totally asymptomatic, no pain, no discomfort. Initially, the line might look a bit translucent or grayish. But over time, as the friction continues, it becomes more distinct and clearly white. It's a flat, smooth line that just gradually blends into the surrounding healthy mucosa. So, what causes it? Linea alba is the result of chronic pressure or frictional irritation. This is most commonly caused by habits like bruxism, grinding or clenching the teeth, or from someone habitually sucking or rubbing their cheeks against their teeth. An interesting point is that you do unnecessarily need an obvious cause like rough dental restorations or malocclusion. You can even see it in patients who don't have any identifiable oral habit. Since there are no symptoms, recurrence isn't really a concept that applies here. It's just a stable, harmless finding. The management is simple. No treatment is needed. All you have to do is reassure the patient that it's a normal variation and nothing to worry about. Next, let's talk about leukoedema. This is another extremely common and completely benign condition. Just like Linea alba, leukoedema requires no treatment whatsoever. It most often affects the buccal mucosa, but you might also find it on the floor of the mouth, the labial mucosa, or even the palatopharyngeal tissues. It's seen in both children and adults, with no real age preference. Unlike a localized patch, leukoedema is a diffuse lesion. This means it covers a broad area of the mucosa and is typically bilateral, affecting both sides of the mouth. The mucosa has a distinct gray-white or milky appearance and can look slightly wrinkled or have fine streaks. Now, here is the key diagnostic feature: and this is crucial. When you gently stretch the affected mucosa, the white appearance disappears or at least significantly diminishes. This simple clinical test alone is often enough to confirm the diagnosis right there in the chair. What's happening on a microscopic level? Leukoedema is caused by a thickening of the epithelium, along with increased keratinization and intracellular edema, or fluid buildup within the cells. These changes alter how light reflects off the tissue, which is what produces that classic white appearance. Like Linea alba, leukoedema is completely asymptomatic. Patients don't feel anything. Since it's a benign condition that we don't treat or remove, the concept of recurrence doesn't apply. So, for management, no treatment is indicated. Again, all that is needed is to reassure the patient that what they have is a harmless variation of normal oral tissue. Alright, let's move on to our third and final lesion, frictional keratosis, which is also known as traumatic hypokeratosis. As the name suggests, this lesion is a reactive response to some form of chronic mechanical irritation. Frictional keratosis can pop up on any oral surface that's exposed to repeated trauma. This includes the buccal mucosa from cheek biting, the edentulous alveolar ridges where teeth are missing, the lateral border of the tongue, the lips, and even the gingiva from aggressive toothbrushing. It's seen more often in adults, simply because they've had more time to develop these long-standing habits. It can occur at any age, but its prevalence definitely increases as people get older. Typically, this is a solitary lesion that appears directly at the site of the irritation. The location itself often points you directly to the cause. For example, if you see a white patch on the cheek that lines up perfectly with a sharp cusp of a molar, you've likely found your culprit. In the early stages, the lesion might appear as a pale or slightly translucent white area, but with ongoing trauma, it gets thicker, more opaque, and can develop into a dense white plaque. The cause is always some form of chronic, low-grade mechanical irritation. Common culprits include sharp or rough teeth, ill-fitting dentures or partials, habitual cheek or tongue biting, chewing on edentulous ridges, or even vigorous brushing of the gums. Most of these lesions are painless, although some patients might notice that the surface feels a bit rough or thickened to their tongues. Now, the management of frictional keratosis is where things get a bit more involved, and it depends entirely on whether you can identify the cause. Let's say you've found a clear source of the irritation, like a sharp tooth edge, a rough spot on a denture, or the patient admits to a habit like cheek biting. In this case, your management plan is straightforward. First, you need to remove or correct that traumatic factor. You might smooth a sharp tooth, adjust the denture, or counsel the patient on their habits. Then, you monitor the area and reevaluate in a few weeks. In most cases, once the source of irritation is gone, the lesion will resolve on its own. But what if it doesn't improve? If you've removed the cause and the white lesion is still there after a reasonable period, you must manage it as a leukoplakia. This means an incisional biopsy is indicated to get a definitive diagnosis. And what if you can't find a cause at all? If you examine the patient and there is no identifiable source of tremor, sharp teeth, no faulty restorations, no habit, then you must also treat this lesion as a leukoplakia from the start. A biopsy is required. This step is absolutely essential to rule out the possibility of dysplasia or malignancy, as some early oral cancers can mimic the appearance of a simple frictional keratosis. So, let's quickly summarize what we've covered. First, linea alba is that harmless white line along the occlusal plane on the inside of the cheeks. No treatment is needed. Second, leukoedema is that diffuse gray-white mucosal change that disappears when you stretch the tissue. Again, no treatment is needed. And third, frictional keratosis is a reactive white lesion caused by chronic trauma. Your job here is to remove the cause and reassess. If it doesn't resolve or if there's no clear cause, a biopsy is necessary. Accurately recognizing these benign entities helps us as clinicians avoid unnecessary procedures while still being vigilant about identifying lesions that truly require further investigation. Understanding the context, location, and clinical behavior of these white lesions is the key to a confident diagnosis. Thank you so much for watching. We hope you found this overview helpful. If you did, please give this video a thumbs up and don't forget to subscribe for more clinical content. We'll see you in the next video.